Very excited to have Dr. Thomas Seyfried here. Sir, you are the author of a very well-read book for my audience anyway. They probably know more about you even than I do. And you came as a guest idea from one of my subscribers. So thank you for everybody who puts in ideas for guests. I'm very excited to have this conversation. Dr. Seyfried is the author of Cancer as a Metabolic Disease. And you may be sitting here thinking, Allison covers censorship. Why, if you're talking to Dr. Seyfried? Well, I often don't hear about cancer as a metabolic disease. And you say that it also doesn't necessarily get maybe the spread that perhaps it should to help people understand cancer. I guess before you even get into your work itself, why do you think that is? Any ideas?
You mean why people have not?
Why do you think it's still so unknown compared to what people would normally hear of, like cancer is you got to go get radiation or chemo, or understanding? I actually think most of us know very little about cancer. We just know it's a bad thing.
Yeah, well, I think the oncology community is in the same boat. They don't really know much about it either, despite all the things they say. If you go on to the National Cancer Institute website, which is part of the National Institute of Health, and they talk a lot about new developments and whatever else they're doing. But when you go to the page, what is cancer? It says clearly cancer is a genetic disease. It does not say it is a metabolic disease. The view of cancer arising as a genetic disease emerged mostly in the 1950s when DNA was discovered as the hereditary material, and broken chromosomes and genetic mutations were found in cancer. And at that time, the field ran off like lemmings over the cliff, and still are jumping off the cliff on this whole thing that cancer is a genetic disease. So you had the multi-billion-dollar Cancer Genome Project that was sponsored by the National Cancer Institute, National Institutes of Health. A vast majority of the research grants given out by the National Health Institute of Health and NCI are all based on some gene mutation. And you hear on the TV at night on major media stations all of these different precision medicines targeting mutations and EGFR receptors, and this all speaks to the dogmatic view that cancer is a genetic disease.
Can I stop you real fast? Because I have a question about this specifically. So I remember, I don't know, a decade cancer, and she did the genetic testing, came back, I guess, with this BRCA gene. And so based on that, not necessarily on the diagnosis itself, she decided to have a double mastectomy. So it's interesting to me from what you're saying, how the treatment or the cure, I guess, is looked at. If it's like, if I have the gene, then I should, ergo do this. What do you think about that as a consequence of what you're talking about?
Yeah, well, that kind of response makes people believe that the gene is a fait accompli to get the disease.
Right.
The BRCA1 mutations, whether it's the BRCA1 or BRCA2 or the combination of the two, produce a risk of about 55%, meaning that 50% or 45% of women with the gene never will develop cancer. And what I have shown in my extensive evaluation is the BRCA gene is a risk factor. It causes cancer only if it damages the energy producing organelle within the cell, which is the mitochondrion. So a woman could get breast cancer from having a BRCA gene risk factor that would damage mitochondria. Another woman could get breast cancer, which would look the same, from an occluded milk duct that would cause a chronic inflammatory site, leading to intermittent hypoxia. Another woman could get cancer from a chemical carcinogen risk factor, another from radiation risk factor. All of these risk factors have one thing in common. They all target and disrupt the energy metabolism in a particular cell of the breast, leading to dysregulated cell growth. So all of these issues are basically related. to damage to the oxidative phosphorylation, which means energy through oxygen. When I say oxidative phosphorylation, that means our cells getting energy because they take in oxygen. We breathe and we breathe oxygen. Oxygen is allowing our cells to generate energy. Cancer cells are different from other cells in the body in that they get energy without oxygen. They do not use oxygen in any significant amount for energy. So cancer cells live and grow without oxygen. And this is a very important distinction. So you'd say, well, how is it possible to get energy without oxygen? And they use an ancient pathway of fermentation. This is an ancient pathway called energy without oxygen. And they have only a few fuels that they can use to do this. And we and others have identified glucose, sugar, and the glutamine amino acid as the two prime fermentable fuels for driving cancer. So the BRCA1, if you were to be diagnosed with a BRCA1, yes, you can go out and do these what we call massive surgical mutilations, or you could know that BRCA1 will not cause cancer if you can keep the mitochondria in your cell healthy and energized. And this is where you can use diet and exercise prevention to significantly reduce the probability of BRCA1 becoming a risk factor. So you can significantly reduce. Well, you can do two things. And the other thing, too, is if you do surgical mutilation, there's no guarantee that at some point in the future, you could generate another type of a cancer from the same risk factor hitting another organ. Maybe not as common as breast and ovaries and things like this, but certainly if you live long enough and you never really addressed the suppressive effect of diet and exercise, you may also experience another type of cancer from that. It's not not a lot has been written on that, but it's certainly a possibility.
Mm-hmm. Yeah, you make a really good point about how it seems like what you're saying is that the gene theory gives people a false sense of, I guess, safety or security, or just a sort of blissful ignorance, I guess, about other stuff where like, okay, I have this gene, I just get my ovaries removed or I get my uterus removed and then I have no problems. Dr. Seyfried, before we go any further into your work and nutrition and everything, when I'll probably feel really guilty about talking about wine, I'm just going to let everybody know. I don't know, maybe wine's not going to be so bad. We'll find out. But don't forget, everybody, you can support my work at AllisonWinePromo.com. 50% off my favorite wines, 50% off shipping. These are all high altitude wines from Argentina, very remote regions. The one in the middle comes from almost 9,000 feet. The ones on the left and the right, almost 6,000 feet. Natural fermentation, no filtration, no additives. It's a great way to support my work. They're really tasty wines. You can't get them at the grocery store. Why would you want to? And gives you a chance to give a gift or get it for yourself and have a great glass of wine while also bringing interviews like Dr. Seyfried on. So AllisonWinePromo.com. And thanks to Bonner Wine for supporting my work. Okay, let's get back to Dr. Seyfried.
Well, wait. Let me.
Go ahead. Talk about wine, please.
Well, let me say something about the wine.
Okay.
We did some studies here in the lab. Because blood sugar is a linked to cancer. The higher your blood sugar, if you have cancer, the faster the tumor will grow. We published that many, many times. So I had some students, dark red wine. I don't know about the bottles that you just showed there, but dark red wines do not elevate blood sugar as much as sweeter wines.
Okay.
We've actually tested that. So if you have cancer, a sip of red wine is not going to provoke your cancer.
Oh, okay. Well, phew. I was really nervous.
No, I wouldn't have badmouthed anything anyway. But the fact that I actually tested dark red wine on my students. And,
one of the reasons that the reason that this wine club sponsors me is because I was on another podcast where they asked me Robert Barnes is a constitutional attorney, and he asked me what my favorite drink is. And I said, I like high altitude Malbecs from Argentina, which is very specific. And the reason is because a doctor friend of mine in the Seattle area, back when I used to live there, he used to talk about these wines from this region because they come from such high altitudes and they're so remote that there's very little pesticide use. And, there's debate, I guess, about what do you call it, like retrovirusol or whatever the phytochemicals are. But the idea is that the grapes work a lot harder to survive. So you get a better taste. It's a more robust taste. And you're likely to get far fewer chemicals in it. And then also this company, they do like the one in the middle is from the oldest vineyard in Argentina. And a lot of them use like very old traditional ways of producing the wine. So it's just lower input, I guess, if you will. Anyway, so that's my pitch.
That's right. I'm not I think the red wines, now I can't speak, some dry white wines are okay too, but
they can give me headaches.
Yeah, sweet wines.
I like a Sauvignon Blanc every once in a while.
Yeah, well, I'm talking about what we do is we measure we publish the glucose ketone index calculator to allow cancer patients to know whether or not they're in the zone of what we call nutritional ketosis. When your body is in therapeutic or nutritional ketosis, blood sugars are lower and blood ketone bodies are higher. And that puts tremendous metabolic stress and pressure on the tumor cells, thus killing them. So when we had students fasting for several days, having a very excellent glucose ketone index, just to see if they could get into the so-called therapeutic zone, which we published as 2.0 or below, and drank dark red wine, we would monitor carefully how elevated the blood sugar would go, and it just went up very, very slightly. And then we did the other experiment where we have them do the same fasting and then gave them Coca-Cola.
Oh, yikes.
Oh, my God. You can't believe how bad that stuff is, man. It is just deadly.
I believe it.
If you want your tumor to grow fast, if you're a cancer patient and you feel that your tumor is not growing as fast as your buddy's tumor, then you go out and you chug down Coca-Cola and you'll get that tumor to grow as fast as you possibly. It's terrible. This is. And if you go to the hospital sometime in the cancer ward, they give you Coca-Cola.
Yeah. Oh, don't even get me started on that. Oh, yeah. Hospitals.
To tell you. Remember, if you want your tumor to grow fast, get your blood sugar up as high as you possibly can. And if you want your tumor to grow slow, get your blood sugar down as low as you can. Not complicated.
That's his main message. Okay. I'm making chocolate these days, which I want to sell, but I'm still trying to perfect my recipe. And also part of the problem is now I live in Florida. I'm making it out of coconut oil and honey. So it's just very basic. I just did a sea salt one, which I think came out really well, except for, like I said, it'll melt when I ship it. So I don't know what I'm going to do. Maybe I'll do drinking chocolate, but my family is totally trying to find different, because we've got sweet tooth. There's like, what can we do? And it's amazing though how addictive sugar is. And I think they probably put other stuff in it too. But yeah, you just get so used to that taste that.
I'll tell you, you want to know how addictive sugar is? Try not eating for 3 to 4 days. Just drink water. I'm telling you. And the reason why it's so uncomfortable is because of the sugar addiction. If you were to have a carnivore diet and then do that, the step to water only fasting would be far, far less painful and uncomfortable than if you go cold turkey. Our brains in our societies today, we are addicted to sugar. And if you don't believe me, stop eating for 3 days and you're going to see what I'm talking about. It's just as hard, like alcohol, drugs, caffeine, nicotine, all these kinds of things are addictive compounds, but man, sugar is right up there with them.
Okay. A couple things real fast before we get to the other question. You still have to talk about what your book is about, but blood type O can't eat coconut oil. I'm an O negative. I eat it. What do you mean you can't? Is that, and then dairy is like jet fuel for cancer cells, especially for women. Is that?
No, coconut oil is really part of the ketogenic diet. I mean, coconut oil is metabolized to ketone bodies very rapidly. So I've never heard of that. Blood. Okay. Are you? I don't know where that come from. I don't know. Show me the paper. Show me the evidence.
Yeah. Show us the evidence. Okay, Dr. Seyfried,
before you listen, when I speak here and tell you and other folks what's going on, I'm not pulling this stuff out of a hat. I have scientific peer-reviewed publications. If anybody wants to fact fact checked anything that I'm saying, just go on just put my name in and say publications, and I have open access publications in peer reviewed journals, and you can fact check everything that I'm saying. So I just want to make some people say, oh, where's the guy gets all this evidence? I did the damn experiments in my lab, for crying out.
Yeah, he's from Boston, so
Yeah.
you got to take him serious. He'll get worked up if you don't.
Well, you got to be careful about that too.
Just kidding. Where can I purchase this book? Why don't you talk real fast about that and why? Because somebody asked about why it's so expensive.
John, why don't you ask John Wiley Press that? You know, that's I asked the same question. Why are you making this thing so expensive? You know,
you can get it on Amazon.
Yeah, you can. And, you know, with this sale, sometimes they have a sale. I don't know. It goes from $150 down to $125, some big sale. No, I apologize. I can't even apologize. I don't even know what to say. That was John Wiley. If I write another one, I'm not so sure I'll go with that publisher. And we're working on a kind of a handbook right now. A handbook. And the other book that's out, a summary of what I said was written by Johnny Rockenmeyer. He said it was written by me, but he just kind of summarized what I said in that book. So that's a lot cheaper. I really haven't read it as carefully as I probably should to see if it's as accurate. But most of the information comes, unfortunately. And the other thing that I get criticized on is it's too heavy. Some of the chapters are too deep into the science. And don't forget that book was written for the scientists in the field. There are a number of chapters on that the layperson can certainly understand, but there are some chapters that are written for if they want to see what the real science of cancer is, then they can feel free to read those chapters.
Okay. And one of the questions about the price of the book was here on Locals, AllisonMorrow.locals.com, or you can pay $5 a month to put questions in ahead of time for interviews. To get another great way to support my work, and you get a high value product out of it. You get to go one-on-one with some of the most censored people on the internet and ask them whatever you want for yourself. Okay. So one of the questions, I think that's not a question. We got so many. So let's see, where was this? Okay. Have you read Dr. Peter J. Adamo's book, Eat Right for Your Blood Type Diet Solution? But before you answer the question, Dr. Seyfried, I want to go back in time to the whole point of your research. Could you give us the primer on what does it mean, cancer as a metabolic disease?
It means that the main problem with cancer cells is how they generate their energy for growth. That's the key. You have to realize without energy, nothing can grow. Cancer cells divide rapidly. They grow out of control. Everybody knows this is what it is. The definition of cancer is dysregulated cell growth or cell growth out of control. So you have to say, well, where's the energy coming from? Where's the energy coming for a cell to grow? And the answer you have to say is that you could get energy from oxygen, or you can get energy without oxygen, which is called fermentation, ancient pathway of fermentation. Cancer cells can grow rapidly without oxygen. So where are they getting their energy? And they get their energy from ancient pathways, heirloomic pathways, evolutionarily conserved heirloomic pathways. That's where they're getting their energy. So when we say cancer is a metabolic disease and not a genetic disease, we mean that the dysregulated growth is coming from disturbed energy metabolism, and that the mutations that you see that the field seems to be obsessed with are all downstream epiphenomena. So if the field is focusing on a downstream effect, the probability of making major breakthroughs in the advancement and management of the disease will not happen in fact, they won't happen. So in fact, we're not going to make any major advance in cancer until it becomes recognized as a metabolic disease. Then you're going to see huge changes real quick. How long it's going to take for the field to adjust to this is uncertain. So just to mention that. So yeah, so I wanted to say that cancer is a metabolic disease based on the type of energy metabolism that the tumor has. So I think that if you go to the National Cancer Institute website, it says cancer is a genetic disease. So the answer to your question is the field itself is driven by the view that, and if you don't subscribe to that view, then you don't get your NIH grant. It's one of these kinds of things.
Mm-hmm.
You better make sure you're in lockstep with what the field thinks. And the field and the pharmaceutical industries are both in lockstep with each other. So if they're advertising on TV at night that target the EGFR receptor mutation in your lung cancer, what the hell does that mean? I mean, I already know the lung cancer, every cancer, bladder cancer, colon cancer, lung cancer, they're all fermenters. They're all getting energy without oxygen. So why are we focusing on downstream epiphenomenon when you can just pull the plug on their energy metabolism and kill them that way? So, but
do you think then? Okay, I guess what creates the metabolic disease? Is it just diet? Is it toxin exposure? What puts you at risk?
These are all called risk factors, and I went through in my book. I clearly showed you all of the different kinds of risk factors that you can have. Everybody knows radiation. Radiation damages energy metabolism. It is a risk factor. Carcinogens, constant exposure to carcinogen. Why they call it a carcinogen? Because it causes cancer. They've found it in a rat, mouse, or something, or in humans. They cause cancer. That's the phenotype. Okay, intermittent hypoxia, chronic inflammation. We can have rare inherited mutations. These are all risk factors. Aging. Age by itself is a risk factor for cancer. Oncogenic viruses, papilloma virus, papilloma hepatitis C viruses. These viruses are called oncogenic viruses because they damage oxidative phosphorylation, energy metabolism, forcing the cell into a fermentation behavior. So all of these things are so-called risk factors, secondary risk factors. The primary risk factor for getting cancer is chronic damage to oxidative phosphorylation, energy from oxygen with compensatory fermentation. That's it in a nutshell. So how do you manage cancer? You take away the fermentable fuels and transition the whole body to a non-fermentable fuel like fatty acids or ketone bodies, which cannot be used by cancer cells for energy.
Okay, let's go back to that question. Have you read Dr. Adamo's book, Eat Right for Your blood type diet solution?
I don't read the diet books. I don't know what to say. All I know is that in order to kill cancer cells, you have to lower glucose and elevate ketones. I don't care what you eat. Whatever you do to lower your blood sugar and elevate your ketones, people should go out and buy the Keto Mojo glucose ketone index monitor. If they think they're eating a good diet and they want to prevent or manage cancer, then they would get their glucose ketone index down real low. I don't care what you eat. If you're a vegan, if you're a carnivore, if you're a pescatarian, whatever you want to think you call yourself, all I know is that to eat whatever you eat, you're going to eat. If you can't get your GKI down to 2.0 or below, change your diet. And then people say, "Oh, I work so hard to try to get my diet. I never got it down." I said, "Well, then stop eating completely and see if it goes down. Do water-only fasting." And then they'll say, "Oh, man, I had to stop eating for 10 days before I could get my GKI down." Okay, great. Now that you're down there, start eating things you normally would. And if you eat vegetables and it makes it go up, don't eat the vegetables. People, or I eat meat, goes up. It doesn't make any difference. Every diet is brought down to a quantitative measure of blood glucose and ketones. So when people say about this diet or that, I have no idea. People have to check it themselves.
Okay. So then that kind of answers the follow-up, which is I and some others from actual experience found keto is the exact opposite diet we needed for health. Are you open to different people eating or needing different diets and many needing a more vegan, not keto diet? Are you familiar with late Dr. Nick Gonzalez's personalized diet approach? So you're basically saying, yeah, you're open to whatever works to get your keto.
It doesn't mean anything. Just get your diet. If you're killing cancer, if you want to join a vegan club or a carnivore club and do whatever you want to do, just because you want to eat meat or you just want to eat vegetables, you have to realize as a species we evolved as omnivores. Okay, if it weren't for meat, and don't forget humans will kill and eat anything that they could find in the Paleolithic period. So you go back to the way we evolved, and you'll find out that we can eat anything. But today in today's world, everybody thinks, oh, carnivore is really healthy. Oh, vegan's really healthy. I don't know what to say about all that stuff. All I know is if you have cancer, you better get your damn GKI down. Otherwise you're going to be in trouble.
Okay, and I'm assuming that you would think people should get that down regardless of whether they have cancer, because the ideal situation
Well,
would be not to get cancer, right?
yeah, well, that's
Okay.
another thing. A lot of people are using it as a preventative measure.
Yeah.
So, and that's right. It's very, very difficult to get cancer if your mitochondria in the cells remain healthy.
Interesting.
Cancer starts from damage to mitochondria in a particular cell in a particular organ.
Hmm.
Okay. If you keep your mitochondria healthy, it's very unlikely that you will get cancer. Okay. And this is seen from our Aboriginal ancestors, our people who live by their natural diets and ways. Cancer is extremely rare in these. In fact, cancer should be extremely rare in our species. The problem is we're in an obesity epidemic. All the things in our environment are provocative risk factors for developing cancer. But you can prevent those by keeping a low GKI periodically. I don't think people can do it. I have a friend. You want to interview somebody? Interview Dominic D'Agostino
Okay.
from Tampa.
Oh, that's
University.
where I'm near there.
Yeah, he's at the University of South Florida. You want
I'll
to
write
talk
it
about
down.
yeah, Dominic people know him. He's a bodybuilder and a scientist he works with NASA.
D'Agostino.
Yeah, Dominic D'Agostino.
I'll look him up.
He's in nutritional ketosis all the time. You
Okay.
can ask what Dom eats, and you'll get a big kick out of if you push him on what he's eating.
Am I going to be able to do my wine read when he comes on? That's the only thing I care
Oh
about.
yeah, oh yeah.
Okay.
I think you can.
Okay, good.
I don't think Dom has any. In fact, the only thing he might drink is a little bit of red wine. He
Oh,
won't. He
okay.
won't touch beer or
All right.
spirits or something.
So I'd say I'll talk to anybody, but I'll talk to anybody who will let me promote my wine. No, I'm just kidding. I would talk. Yeah, even if somebody hated my wine, I still
Well, I
have
haven't
wine.
tasted your wine yet, so I don't know.
Yeah,
But
that's true. It may just taste like crap. It won't. It
no,
won't necessarily give you cancer, but it is terrible wine. No,
I don't know. You're the one telling us how good it is. I
I
never.
think it's good, but taste is subjective. Taste
Yeah,
is
it is.
subjective. I can't help it if I have a more refined palate than everybody else. I mean, it's clearly. Okay, so I should have brought this up when we were doing the Coke. By the way, I did see people. There's YouTube videos about how you can clean your toilet with Coke. So I mean, I knew that is bad because I've seen that. I just saw a study. Ric Flair too says linking sugary drinks with liver cancer. In the study of 90,000 women, it showed that drinking just one soft drink a day increased the risk of liver cancer by 73%. Could Dr. Seyfried please comment on this study and the dangers of sugary drinks in general? Yes, including diet soft drinks. Anything further you want to add to that?
I don't know what to say about that. I mean, there's a lot of risk factors that yeah, sugar doesn't cause cancer, but sugar can lead to systemic inflammation and what linked to type 2 diabetes and obesity. Obesity now has replaced smoking as one of the top risk factors for developing cancer. And one of the things you should realize is that if people were really, really concerned about preventing cancer, we would not have an obesity epidemic. The fact that we have an obesity epidemic means that most people don't care about cancer risk factors. If they did, there wouldn't be an obesity epidemic and an epidemic of type 2 diabetes. So do these folks not know that obesity and type 2 diabetes are they don't know that these are risk factors for cancer? I mean, the evidence is like overwhelming. So I'm telling everybody now, obesity, if you, it's just as bad as smoking.
But what do
Everybody
you
knows.
think about? I mean, I know you don't want to talk politics or anything, so you don't have to get into this with me if you don't want. But I hear constantly nowadays on the news about how it's like, you're shaming people if you bring this up. Like there's a lot of hesitance now in the world to call it what it is, to say it's obesity. Now, you could be looked at like you're just being insensitive and mean, like big is beautiful. And there's just
Well,
a
I
lot of
mean,
pressure. It seems even the scientific community, there's pressure to like just avoid that.
well, I mean, I mean, look at the American Cancer Society. They're the ones
I
telling
don't
us
trust
this.
them.
Well, yeah, but you know what they do? It's a real good. You know what they do really well? They log the dead. They do
Okay.
it. Let me tell you that every year they come out with how many people are dying from the various kinds of cancers. So we know that. I look at them. I said it's great that they would put this energy to let everybody know what type of cancers are killing us. and they do a pretty good job. Not a great job, and there's flaws in everything that you can have, but they seem to do a pretty good job logging the dead. And right now, over 1,600 people a day are dying from cancer in the United States, and this is breast cancer in women has now replaced heart disease as the #1 killer of women. So you have to realize when you raise money for the Pink Ribbon campaign, the more money you raise for the Pink Ribbon campaign, the more breast cancer you're going to get. So it's true. I mean, they've been raising money, putting pink on airplanes, and pink, everything is pink, cancer, breast cancer awareness month. So you get the more money we raise for breast cancer, the more breast cancer we get. Then you say to yourself, why is that? I mean, we've been pink ribbon, we've been running, swimming, jumping, biking for breast cancer for the last 30 years. And now we have breast cancer overtaking, heart disease. So one of the things people have to realize, ask, where the hell is all the money? Why is there no accountability for all the money I'm raising for any kind of a cancer? And the question is, you find out that a lot of that money, we're going to raise money for what kind of research are you doing? The research that gives us more cancer? Is that what that? So you find out that it's going to gene therapy. It's going to the idea that cancer is a genetic disease, and it's not a genetic disease. So you might as well take that money and just flush it. You use that and the Coca-Cola to clean your toilet bowls. So,
yeah, there you go. Yeah, well, Coke is probably cheaper than your average toilet bowl cleaner. So if you want to save some money, that might be an option for you. All right. Okay, everybody. Before we go any further, you wear glasses. I don't think glasses raise your ketone levels, but if you do wear glasses and any kind of, you like progressives, you want an amazing pair of progressive lenses, blue light blocking glasses, whatever problem you got with your eyes, I'm telling you, betterspectacles.com/BIG. That's where you can go, or call 313-801-2272. Where am I? I don't see my other blue light blocking glasses that they made me are not here right now, but trust me, they're awesome. These are also blue light blocking, but they didn't make them. I like the other ones better. I wear these because they're now my show glasses. People revolt when I don't wear them. I'm sorry. You just have to deal with it. So just trust me. If you want to support my work and you're looking for some amazing glasses, go here. Now, they do offer biometric intelligent glasses based on artificial intelligence scans if you want to have your eyes scanned. If you're freaked out that they're going to send the information to the FBI, that's totally fine too. You can go get a pair of glasses that they have developed for you, basically custom, based on 500,000 other people's eye scans and 7,000 data points. The prescription is across the total lens. It's not just like in the center, like a lot of glasses. And they stand by the blue light part too. A lot of blue light glasses, they promise to blue light blocking. They're not really doing what they say. Anyway, new sponsor, go check them out. betterspectacles.com/BIG. If you request an appointment, see that little orange box, it'll come up with an email or the phone number, or you can just call 313-801-2272. Let them know that Allison Morrow sent you, and let me know what you think. Okay. All right. Let's go back over to some questions. Why are people so hesitant or reluctant to change their eating habits? LSM asks.
How do I know? I don't know. I mean, change their eating habits.
Well, it could be the actual chemical addiction you're talking about with the sugar. I mean, that is difficult to break.
Well, it's not just the sugar, it's the highly processed carbohydrate foods.
Well, why do you think more people aren't interested? I mean, maybe a better question is, there are so many people who don't even care. They don't even want to know.
Yeah.
That's even harder, I think, to understand than the people who are like, okay, I know, and I'm addicted to sugar. But there's so many people that are just totally not interested in understanding all the different things that are related to health outside of like what you see at a minute-long ad running in between the news on the latest drug treatment that has like 18,000 side effects, but you could do this particular drug.
Yeah, I don't know. I mean, it's easy to buy food from all kinds of fast food places. I can't answer that. I think it's just a personal thing. I just think people have to know risk factors and do the best they can. But I don't study those kinds of things.
You're not a psychologist.
Yeah, no. I study how to kill cancer cells without harming the body. How do we manage cancer? That's the key, and the science behind that. I think I'm more qualified to speak on that subject than why somebody can't stop eating some fast food thing to make them feel good. I mean, that's something else.
Okay, I think I got to that other question. Okay, this is my dad, Dr. Chip Abrahamson. He is an orthopedic surgeon, but he's gotten really into nutrition as of late. Gabor Mate in the documentary Zeitgeist Moving Forward said very few diseases are genetic, that childhood trauma and the resulting maladaptive behaviors like eating comfort foods leads to most disease. 2 questions. Do you also believe it is not genes but genetic expression that underlines most disease? I think you've said yes. Would that be right?
Yeah. Well, it's a hard question to answer. It's predominantly risk factors that subject our body to damage to the respiration. And as I said, I went through the various risk factors. A lot of the incorrect diets are imbalanced, leading to systemic inflammation. So again, you have to go back to the biomarkers and the biochemical changes, the shift from what we call metabolic homeostasis. This is where we're pretty pristine in the blood work and the overall health biomarkers in our body. You look at a lot of people who have cancer. It's not just cancer they have. Many are obese. They have type 2 diabetes, high blood pressure, hypertension. They have a lot of other comorbidities. Most of these comorbidities are the result of diet and lifestyle. So when you put diet and lifestyle, it's probably the single greatest risk factor for developing cancer. The inherited risk factors, the highest inherited risk factor is the Li-Fraumeni P53 mutation, where it's about an 85% probability. But again, it's not 100% penetrance, which means the probability of seeing the phenotype, which would be a cancer as the result of this mutation. That's about the highest one I can find. All the others are much lower than that. But they're all considered secondary risk factors. Primary risk factors damage to the mitochondria.
I see. Okay, so you're not throwing genetics out altogether. You're just saying, look, like you said with the BRCA, 50% aren't going to get it. So you can't just say it's just that. Like if you have it, you're for sure going to get it. So it's a risk factor, but not.
It's a secondary. The primary risk factor caused by BRCA1 and all the others is damage to oxidative phosphorus, damage to the mitochondria within the cell. That's the primary cause of cancer.
Okay, this is another question you're probably not going to want to answer because you're not a psychologist, but are most cancers caused by ignorance of the proper dietary restrictions, influenced by the sugar industry, or by emotional need for comfort foods? I notice many managers, he works at a hospital where I work, buy donuts in the morning to make the workers feel better. Also, instead of feed a fever and starve a cold, maybe it should be feed a brain keto and starve a cancer. Lastly, what would I find in your book that was not highlighted or included in Tripping Over the Truth by Travis Christofferson?
Yeah, well, Travis wrote his book based on my book. He found it to be profound, that I would say, and well, I provided the scientific evidence for this, and he wanted to bring it more to the lay people, lay public, what this whole cancer thing was, and it is a metabolic disease, and I think as soon as we realize that, then the strategies for managing cancer become very, very different than what we're doing today. Not only preventing cancer, but also how do we manage it? Listen, so I think you said that radiation and chemo, these are poisonous and radical approaches. People aren't, when they got diagnosed with cancer, they're not looking forward to going down and getting toxic poison put in their body or being irradiated. They're not looking forward to this. They fear that almost as much as they fear the disease. And then you get all these new ones, the PD-L1 inhibitor, PD-1, PD-L1, CAR-T immunotherapy. These are the ones you hear pushed. These are all based on the somatic genetic theory of cancer, the somatic gene mutation theory. So if the theory under which the disease is viewed is not correct, what is the probability that we're going to see dramatic improvements in overall outcome? And to be honest with you, we do find some folks that are really respond well to some of these new therapies, but we also find a significant number that are killed faster than the cancer would. If they didn't do anything to the tumor, taking the drug would kill them faster than doing nothing. So it's called hyperprogressive disease. You want to know about it? You should look it up. when you hear these therapies advertised on television, where the pharmaceutical companies are advertising their stuff on TV. Nobody's advertising metabolic therapy on TV.
Yeah.
Get your glucose ketone index down, folks, and let's see how much is that going to cost? You save money on it. You don't have to eat as much food. So, but you don't see that advertised. And where are the clinical trials showing that metabolic therapy can be really, really good? Well, who's going to step forward and do a metabolic trial showing that ketogenic metabolic therapy and lower GKI is going to have a very powerful effect on managing your disease? No one, at least not up to this point, unless you have some, I don't know, the federal government should be the ones doing this, but I don't know why they're not, because they think cancer is a genetic disease. So it all comes back to these controversial positions. But the evidence that cancer is a metabolic disease is so strong, it's so profound. You wonder why the field can't understand that. It has to be ideological dogma, which is that you cannot change your opinion because you're part of a mindset. It's like a religion. So you can't change your religion. You believe cancer is a genetic disease, and you absolutely doing that because you're getting well paid to think that it's a disease. But in the real world, it's not it's a metabolic disease. So you have a lot of issues preventing the idea that we can manage this disease with a lot less toxicity, with a tremendously better outcome than we are currently doing.
Mm-hmm. Well, I think that what you just described, it is across the board in every industry, no matter who I have on. That's what they say about why they get ostracized or whatever, and nobody's interested in hearing is the same condition you just described. So I don't know if the human condition or
yeah,
what,
but in what I'm describing, we're having over 1,600 people a day suffering and dying from this. Yeah. This is not insignificant.
No, it's not. But like, for instance, one time I went into the dentist office and just not on purpose, but I hadn't been to the dentist in a few years because I had a kid or actually, no, this was before I had a kid. I was in TV news and whatever. I moved to Seattle. I couldn't find a dentist. I was overworked and anyway, but I had a really good diet and I was taking a lot, cod liver oil / butter oil blend, which is high vitamin D. And anyway, I think I eat, a very nutritious diet and take care of my teeth, whatever. So I go in and I didn't have any cavities and they said my gums looked amazing. And what I noticed was that they did not want to know why I was able, because they were shocked that I hadn't been to the dentist in 3 years and they thought they were going to find all these cavities. They didn't find a single cavity. But nobody wanted to know why. My dad actually had a similar experience. The reason he got into nutrition was because he started reading up on why would you need a root canal? What would be the reason? Like, and how do you know when you should really get one? Anyway, he totally changed his diet, and he ended up not even needing the root canal, the 7 root canals or whatever that his dentist said he needed. And his dentist never even wanted to know what he did. So there's a lot of doctors, they see these problems all the time. But if you were interested in like actually helping your patients, that you would want to know what the anomaly is doing. Like, at least you'd be curious. You may not totally change everything you do, but you would at least ask a question about it. What did you do? How did you keep yourself I see all these people that come in every 6 months and they all have cavities. What's different about you? But they don't even want to know, which I think is weird.
It's not only weird, it's profound.
Let me real fast, Dr. Seyfried, let me ask you this. Okay, so Jay Butters is saying, how do we kill cancer cells? And then ask the good MD, or he's not an MD, you're a PhD, right?
Yeah.
Yeah, he is aware of the skin dose in mammograms, and if the prevention is worse than the disease. Chip Abrahamson, what about the everybody makes cancer cells every day? So that's 3 to throw at you right now.
Everybody makes cancer cells every day. I don't know. I have no evidence to support that. How do we know that? Does anybody, what are we doing? Running around taking biopsies on everybody's tissue every day to see if we have cancer? No, we don't do that. What is funny though, recent studies over the last 5 years have shown that if we do genetic screening on normal tissues for whatever reason, like biopsies, you find large numbers of mutations, and especially in what we call driver genes. Now, you have to realize those in the field that think cancer is a genetic disease often speak about driver mutations. So you can have passenger mutations and other kinds of mutations, but the ones that are supposed to cause dysregulated cell growth are been classified as driver mutations. Well, now we're finding hundreds of different kinds of driver mutations in normal tissues that never become cancer. So again, what does that mean? If we have all of these so-called powerful driver genes in cells that never become cancer, and that goes back to the question, oh, we're forming cancer cells every day. Are we really? Who knows that? You know, and somebody, well, if I have a tumor, well, yeah, you formed that tumor for sure. But are you telling me all these normal people walking around are forming cancer cells every day? Somebody said that. I don't know where the evidence is to support that. But we know we have driver gene mutations in normal cells, and they're in every one of our normal tissues, and they're not developing cancer. How do you explain that? And then we have cancers that some cancers have no mutations. People say, oh, cancer they're caused by mutations. Oh yeah. Well, what about those cancer cells that have been described by a number of investigators where they can't find any mutation? Well, then they say, well, they haven't looked hard enough. Give me a break. They look with the most deep technologies, and they can't find some mutations. And then we have these driver gene mutations in normal cells that never develop cancer. And then you say to yourself, man, to think cancer is a genetic disease, you have to be cognitively impaired. So, and I'll say that to the National Cancer Institute, because when you sit down and look at the data and you think cancer is a genetic disease, you are cognitively impaired.
You're making me miss living in Boston, where everybody's a real straight shooter. Okay, going back to a couple of questions in the live chat. Okay, what about are you aware of the skin dose in mammograms and if the prevention is worse than the disease? And then there was the other question about how do we kill cancer cells?
Well, I don't know anything about the skin thing. I haven't looked into that. But I told you, a cancer cell can't grow without energy, right? I said that. I'll say it again. No cell can grow without energy. Cancer cells get energy from the ancient pathways of fermentation, the glucose pathway, glycolysis, and the glutamine pathway, glutaminolysis. So these are fermentation. They can generate ATP. Adenosine triphosphate is the currency of energy in our cells. So you can get energy from both glucose and glutamine. They provide all of the nutrients that cancer cells need to grow and get energy. So how do we kill cancer cells? We take away their fermentable fuels. How do we do that? Well, glucose can be pushed down real low with diet and exercise. Glutamine requires drugs. So there are drugs available that can specifically target the availability of glutamine. Our protocol for treatment of cancer is put the patient into therapeutic ketosis first. Cancer cells cannot burn fatty acids or ketone bodies for energy because they're mitochondria defective. Once we put the patient in ketosis, then we use drugs and procedures to further hammer down glucose and glutamine. And that will eventually resolve the disease, hopefully, or manage it. It can either we don't know if we cure it or not. All we know is we can effectively manage it. And we published the Press Pulse paper where we press glucose and pulse glutamine. And it's a strategy that will be successful in killing tumor cells without harming normal cells of the body. You will not lose hair. You will not bleed from your gums. You will not have crippling fatigue, diarrhea, nausea, vomiting. You will not have any of these characteristics as you slowly degrade the tumor. How do we know this? Because we know the tumor cells can't live without fermentation. What's the fuel for fermentation? Glucose and glutamine. How do you know that? Because I looked at every damn tumor cell that we know of, and they're all defective in mitochondrial function structure. So we know that they have to ferment. All these different tumors are all dependent on fermentation. Brain, breast, colon. They're all very, very similar. Can't live without fermentation. Targeting fermentation is so much easier and less toxic than anything that we're doing out there presently. So how long is it going to take for people to know what I just said? How long is it going to take for the oncologists to read the papers that actually provide the evidence for what I just said? I don't know. As I said, when the patient goes to the oncologist, ask them, do they know cancer is a genetic disease that lives on fermentation? And see how many oncologists say, well, I never heard of that. That they'll tell you right off the bat whether they know anything or not.
Oh, well, I've had so many experiences bringing in scientific papers to doctors who say to me, I don't have time to read that. So that's always encouraging.
Yeah, I know. It's sad. It's very sad. It's tragic.
Like they expect like the patient has to be the doctor too. I mean, it's nuts. But
Well,
okay,
yeah. One more thing. When you do metabolic therapy, now a lot of the responsibility in health falls on the shoulders of the patient. They
yeah,
have to be. And when I speak about metabolic therapy, the patient has to be a prime motivator for them to do this. They just don't sit in a chair and get infused with poison.
right,
You
right.
know, you have to be you have to understand. You're measuring your GKI. You're actually in constant conversation with your healthcare provider to keep you on the right track.
How do you find a healthcare provider then? Do you know of people? Because there was a question that came in like, so how do I find a doctor? Or how do I test my doctor on this if I want to find somebody that
Yeah.
that's of your
Yeah.
mindset?
Well, that's the biggest problem right now because these poor physicians are not trained in medical school. They're not trained to understand metabolic therapy. They're just given a routine training procedure for whatever they do. For chemo and radiation, they're trained to use this without killing the patient. And a variety of other things. But the fact that they're using these terrible toxic poisons tells me that they're not trained in the right way. This is not the right way to treat another human being, with their hair fall. What are you looking at? Poor guy goes bald because he's trying to. What you're trying to kill cancer cells, not hair follicles. It'll have adverse effects. Now there are a lot of people on the planet who are what we call cancer survivors. There's no question about the treatments that they have received in successfully managing their cancer. But many of these folks pay an enormous a price for this. They have all kinds of adverse effects that persist in their life. Neuroendocrine imbalances, digestive imbalance, hormonal imbalance, neuropsychiatric problems, effects of surgical mutilations. I mean, you don't come out of this often, not as good as you were when you started with the treatment. Metabolic therapy is designed to degrade the tumor slowly while enhancing the health and vitality of the body. So not only do you get rid of your tumor cells, but you often get rid of type 2 diabetes, hypertension, and a variety of these other conditions that are putting you at risk for all kinds of things.
Mm-hmm.
So again, people are just going to have to become educated about this. We have a condition of scientific illiteracy in this country. And it's not only among the population, it's among the oncologists themselves. So we have people that don't know much, and we have the caregiver that doesn't know much. And you put those two together, and you got a problem. Over 1,600 people a day dying from cancer. So it's incumbent upon people to start looking and saying, what's going on with this whole thing, because they'll come to realize that they can do a lot of this and help themselves, and they just need a healthcare provider that can assist them and keep them on the right track. So we have to retrain oncologists. The oncology community has to be completely retrained. Now, that doesn't mean we don't use radiation and chemo. We can use these tools in lower dosages and less aggressive approaches. They work together with the metabolic therapy to achieve an outcome with minimal toxicity and the most likely outcome of positivity. So again, we have to relearn what we know about certain things, and learn how to manipulate these in the right way.
Okay. This is a very long one. I'm not going to read in total. If you want to read it, go over to AlisonMorrow.locals.com. Oh, whoops.
I can't see it. I mean, it's just.
Oh, you can't. Yeah, it's too long.
But
basically,
it's too small as well. Maybe I need some of those special glasses.
Yeah, you need to go get my glasses. Yeah. It's just basically this person was overweight, had really bad sciatica. The neurosurgeon said they're going to do surgery, kind of freaked out, looked for other options besides surgery, changed to keto diet, cut carbs and sugar, 6 weeks, canceled surgery, all pain was gone. Okay, so there you go. That's the gist. Andrea, with the dietary guidelines being the basis of nutrition, do you think school lunch programs or military rations will ever be corrected to account for the needed saturated fat and proteins? Especially concerned with school lunch program. For children, this could be the only meal they get today. To be full of just processed junk food that does not provide enough nutrients, how do we expect kids to learn, let alone be healthy?
Well, that's a good question, but I think they probably have to take that up with their local school districts.
Okay. I've heard that there isn't one cancer type of process. Could he comment?
There is one. Their fermentation is the common phenotype of all major cancers.
studies on canine fasting and canine cancer.
Yeah, I published a major paper on this just recently. People should go look it up. How metabolic therapy was able to completely resolve mast cell tumor in a pit bull.
Interesting.
Yeah,
Really?
yeah, open access. Guy, go out and look at it. It's unbelievable. And I have pictures of the dog's face.
Wow.
The woman just simply followed what we said, and cut the calories of the dog. All natural, raw chicken meat from the Whole Foods with the bone in it.
Yeah.
Little fish oil, raw egg, and cut the calories by 40%. The dog lost 5 pounds, and within 3 or 4 months, the tumor was gone. Now the dog died of old age, 15 years of age from heart failure. That's
Wow.
So it was a pit bull, lived to be 15 and a half years.
Amazing.
Now, the dog was 7 years old when it got the cancer on its face. And the doctor said, same thing, radiation and chemo. It was going to cost like several $1,000s, and the dog would live maybe 9 months.
Wow.
So I published the paper. People can go out and look at it. And
what's it called?
Yeah, it's called. It's in open access. It's in. I think
I'll look it up.
Yeah, it's a mast cell tumor of a dog resolved from metabolic, something like that. It's probably just look mine up and I published the paper.
Okay,
Yeah.
I'm looking it up. I'll show people.
People say, well, wait, look at the diet that woman. Now, here's a woman who knew nothing about cancer, just followed what we said, and she developed the diet for her dog, and she put the dog on a vegan diet at first, made the tumor grow twice as fast. So clearly, dogs did not evolve to eat vegetables. You got to realize that.
Yeah, this is it, I think. Right? Case report resolution of malignant canine mast cell tumors and ketogenic metabolic therapy.
Yeah, people should know that recipe in there. What she did has been shown to work on a lot of dogs with different cancers.
Oh, so, really? Okay.
Yeah, and I have everything in there, exactly what she did. The pictures are in there. Go to is there a picture there? You can see the dog's face in there.
Oh, yeah, right there. Mm-hmm.
Yeah, so you see that? Look at that. Big
wow. Amazing.
Yeah, metabolic therapy in the dog, baby. It works.
Well, we, one of my learning lessons, I wish I had learned it earlier on, is to just, the current dog we have, but I wish I had done it with our dog who died a few years ago, was just total raw. I mean, the dog we have now is, she eats a totally raw diet. She has ever since we got her.
I think you have to know the recipe that this woman used. She was from Georgia.
Okay.
She used a lot of very highly nutritious.
I'd like to make it ourselves.
Yeah, she did. So
because it's cheaper that way.
Yeah, well, I don't know if you're buying really good meat from the Whole Foods and stuff like that. Some of that can be kind of expensive.
Whole Foods is a marketing scam. We buy from farmers.
Okay, well, that's just as good. I mean, or better maybe.
It's better.
Okay, well, I'm not gonna. Hey, listen, I'm not gonna, stand here and argue about which is better. Well, if you're getting natural farm beef raised, nothing could be better, because the dog evolved from a wolf.
Yeah.
What do wolves eat? You see them eating chicken. They'll kill elk. They'll eat but they don't eat vegetable. You never saw a pack of wolves attack a cornfield. So they're not going to be. Dogs don't eat vegetables. They eat meat and they eat things like this, but they're not a big vegetarian.
Well, the only reason I just tell people about Whole Foods, because I used to go to Whole Foods all the time. You spend a lot of money, but you really have to read labels because you just don't know. And if you buy direct from, a regenerative farmer who's got chickens out on pasture eating worms and stuff, it's a way better than going to Whole Foods and buying a chicken that may have still been corn fed, in some factory farm. So that's the only reason I bring that up.
No, I agree. I agree. But in Boston, we don't have too many of these free chickens running around.
I bet you have tons of farmers that go to markets though.
Yeah, well, I think you have to go more in the western part of the state.
Yeah,
I don't see too many. There's a few farm stands, for small amounts of things, but we don't have the.
You don't have a farmer's market?
In North End, they bring all the farm stuff in on the weekend.
Yeah, like a weekend. Yeah, something like that. Or what we do is what we do is we find a farmer, and then you just buy directly. Like you go an hour or wherever you have to go, and you buy 6 chickens, and then you just do it once a month, or 4 frozen chickens. You just do it once a month or something like that. Anyway, that's what we do. Now we're going to start raising our own chickens, but Okay. What my white cell count was 40,000. This is Rick Height. including bad white cells, when I was diagnosed with chronic myeloid leukemia in 2012 and an oral chemo for 8 years. Now in cellular remission, but it still can be detected. I could diet below my skinny high school weight and it wouldn't change my cellular condition, although I don't discount it for some conditions, just apprehensive when I hear the diet thing. Everything is relative. What do you think about that?
Well, I mean, multiple myeloma is similar to all the other major cancers. I mean, it's fermenting. So, I mean, you could, and again, I'm not a physician. I can't tell anybody what to do or what not to do. All I can say is that, you know, a metabolic approach with a low GKI, continuing with some certain drugs that have shown to be therapeutic for that condition, might offer even a better outcome. I mean, I've seen a lot of folks that have multiple myeloma that have done metabolic therapy in a kind of a hybrid way with this traditional medication. They've seemed to be doing pretty well. So, you know, it's an individual thing, but at least you have different options that you can try.
Okay, I got a couple more questions for you, Dr. Seyfried. Can you hang out, or you got a few more minutes?
Okay.
Okay. I'm going to take us off YouTube because some of these questions, I think, I'm just going to say I like to answer them better on the other